Hey, welcome to another Topic Tuesday. This is Dr. Mike McCall, Source Health Center. I'm going to talk about vertigo and dizziness. Well, one thing, if you ever have those, and it's hard to know which one you have, well, when you go to the doctor, the first thing we try to figure out is it dizziness or vertigo. Dizziness is if you feel lightheaded or you get tunnel vision or that type of thing. A vertigo is different. It feels like the room is spinning, or you feel like you're going through motion even though you're standing still. Both have different types of approaches. Dizziness, especially the kind that if you've been sitting for a while and you stand up really quickly and you feel lightheaded, is called orthostatic hypertension. I learned that word in chiropractic school and I'm still paying money for that. And that is usually is that your blood pressure should actually rise with standing. The top number should go about 8 millimeters of mercury up to 10. And that's a normal response. What happens is you stand up, your body isn't responding quick enough to keep the blood in your brain because it's draining out of there. So that could be one thing. Vertigo is a little bit different. You can get that from a head trauma, so a motor vehicle accident or you hit your head. And it's a really terrible thing to have. It's really, really tough. A bad concussion could be that as well. But I have had some people with vertigo where there might have been no mechanism of injury, and they responded with a lot of things. So if you have vertigo, a great thing for you to do is go on YouTube and type in the Epley maneuver, E-P-L-Y. Do that. My mother recently had a case a while back, and her ear, nose, and throat doctor couldn't figure it out. She went to a physical therapist, and they did the Epley maneuver, and she feels great. That's a non-toxic, non-invasive treatment that can really help you out if you have not been able to do that. If you haven't been able to get relief from that, I have found in my practice that you can get relief by a lot of times is adjusting. A lot of chiropractors, we like to adjust up here, but you can adjust here. This spinal level has a lot to do with helping the brain with vascular. It's really, really important. And I frequently find that they're stressed, and I direct care of the adrenal glands, and sometimes I can help. But I've had cases that I couldn't help, and I have found that there's these chiropractors who have an advanced degree in neurology. They're called chiropractic neurologists, or you may see them as a diplomate in neurology. And they can take my treatment to another level if it's not working. And they can find the imbalances that are in the brain very non-toxic, very inexpensive in some cases, depends on the doctor. But you may want to look that up if you've kind of done everything I've said and you want to take it one step further. They have a really great way of evaluating with that. I had a patient that really worked out for them, and they were suffering for a while with it. So staying up and getting dizzy, that's adrenal glands. You got to drink some more water, maybe add some more salt in your diet, unless your doctor told you not to have salt. And I can't tell you to have salt because that's crazy, but that's the truth. So you may want to look into that. Look into the adrenal glands. There's a lot of functional medicine doctor that can look into that. Not that you have a disease or anything, but they may see that you might need some help with that. And then with the true vertigo, chiropractic can help. Sometimes the upper cervicals can help. Epley maneuver, remember I told you about that. And if none of that's working and this is just boring you, I think I got one more card for you to play, and that is that chiropractic neurologist. So we'll see you next Tuesday.